All right, this time let's take a look at some of the blood flow in and out of the cardiac muscle itself. So not talking about those chambers of the heart, but the actual cardiac muscle. That muscle is very active and has to receive a large blood supply, and of course it does. So let's go back to the aorta once again. Now remember, the aorta has several sections, but the first section is called the ascending aorta. Now coming off of that ascending aorta, which you can see way down bottom at the bottom of it, you can see is the right coronary artery and your left coronary artery. So that right and left coronary artery are the two branches which come off of that ascending aorta. So as the left ventricle of the heart pumps blood into that aorta, well, some of that blood goes into these coronary arteries and comes right back to the heart muscle itself. Shows you where the heart is pumping blood to itself, just like it is everything else. But let's go back to this right coronary artery. Notice how you see it coming obviously over here towards the right side of the heart. As you get to the right edge or margin, it has a branch called the right marginal artery. And then if you follow it to the back, it also has a division called the posterior interventricular. Now that goes down the back right in between the two ventricles. Now interventricular means between the ventricles, right? Inter always means between. And since it's going down the back right in between them, descending. If you ever hear about those descending arteries of the heart, those are the interventricular. So let's look at that one more time right there. Again, you come up to this ascending aorta. It's got two branches coming off of it, right and left coronary. We go back to the right coronary. Over on the right edge or margin is the right marginal. It's a branch off that right coronary. And another branch to the back, the posterior to the back, interventricular or posterior descending, whatever you like. Let's go back to this left coronary artery. Obviously coming over here more towards the left pump of the heart. As it gets to the left edge or margin, there's a left marginal artery. There's also a circumflex going more to the rear and left side of the heart too. And it's just as there was a posterior interventricular on the back, there's an anterior interventricular to the front. So again, start with the ascending aorta. You're talking about blood flow going to the cardiac muscle itself. There's your right and left coronary. First two branches. Two things that come off that ascending aorta there. If you look back at the right coronary, on the right edge or margin is the right marginal. To the back, posterior interventricular. On the back, between the two ventricles. Go back to that left coronary. Now it's got a branch called the left marginal, obviously on the left edge or margin of the heart. On the front, anterior interventricular, right down the front and in between the ventricles. And then there's that left circumflex. So notice how over on the right side, there's three major arteries which are usually discussed, and on the left side, four. And since that left ventricle of the heart has far more cardiac muscle, has to generate a lot more pressure, makes sense there would be more blood flow to the left side with more muscle than what you have with the right. So good view right there looking at these major blood vessels taking blood in and out of the cardiac muscle.